Hi, everyone. I am Dr. Jeanette DeWitt, and I am a physical therapist, an athletic trainer, and a fitness coach here at DeWitt Physical Therapy and Wellness. Today, during our class, we're going to talk about what do we do when we need more physical therapy, but our insurance company says no. Well, let's kind of start the conversation a little bit with exactly what does insurance do and what is the purpose of insurance, and basically just a little bit of insurance basics. So when you pay into an insurance plan, you are paying into an agreement with that insurance company stating that you agree to the terms of their coverage. The problem is that this can be a little bit confusing because we don't always have a say in what our plan is. We're offered a couple of plan choices by our employer, or we do go online if we're self-employed to pick a plan that we think might fit for us. But the problem, or I should say the confusing part is, we'll just use Blue Cross Blue Shield as an example. If somebody has a Blue Cross Blue Shield plan, then their plan may be different than the plan of another Blue Cross Blue Shield participant. So even though it's the same insurance company, there are multiple plans within an insurance company. So that's why everybody might have the same company, but their plans are all going to be different. So that's a little bit of insurance basics. Now, what is the purpose of insurance? Well, first, it's there to help you pay for healthcare. Now, that may seem kind of basic, but that's exactly what health insurance is. It's there to help you, and the key word is help. You are still responsible for some of the healthcare coverage that you are participating in. The insurance plan that you have is there to help you pay for it. The other thing that health insurance does is it protects you and your family in case of a catastrophic illness or a catastrophic injury. So again, it's going to help you pay for your health care. Now, what will insurance cover? Well, insurance covers return to function. What is exactly return to function? Well, return to function is basically, in insurance world, it is, can you get back to doing some of your basic things? Can you walk from room to room in your house or your home? Can you complete errands in the community? Can you bathe yourself or take care of yourself or provide for your self-care needs? For example, showering, cooking, eating, using utensils to eat, washing your hair, brushing your teeth. Can you stand to do these things? Do you need accommodations to help you do these things? Are you able, if you're a student, are you able to participate in your classes at school? That includes physical education. That includes music class, art class, any of the required classes. Are you able to participate as a student in your schoolwork appropriate for your age? Now, what insurance does not cover is typically wellness programs or maintenance programs or even return to sport. Because a student athlete plays a sport after school, that is an extracurricular activity. That's not a required class as part of a school curriculum. So insurance often does not cover return to sport. They also don't often cover a maintenance program. For example, if somebody requires cardiovascular activity because they had a cardiovascular event, like a heart attack, and once they go through the hospital surgery, once they go through rehabilitation, once they complete that physical therapy and that cardiac rehabilitation, they're not, the insurance may or may not cover the post-rehab or the maintenance program to maintain good cardiovascular health. The other thing an insurance company won't cover is a wellness program that helps with fall prevention. So for an elderly person or a person who has a balance challenge, regardless of their age, the insurance company will not cover a wellness program to prevent a fall. Now, when we look at return to function can vary per person. For example, if we look at a high school football player, the high school football player is going to have a completely different definition of return to function than an elderly, frail woman, because their needs are different. And so the high school football player, return to function for them is going to be to get back to playing their sport, because if they're in high school, maybe they want to play at the collegiate level, or at the very least, they want to be able to participate in fitness and working out and lifting weights. And once they complete their physical therapy and they're able to do things that a normal student can do, or a typical student can do, their insurance company may not allow them to continue physical therapy for the return to football. Now, return to function for an elderly person, a frail person, they have different needs, obviously, than the football player. Their needs may be to be able to stand for 20 minutes to make a meal, or to walk at the grocery store for 35 to 45 minutes to complete their grocery shopping. And they definitely want to be able to complete all of their daily tasks like showering, cooking, doing laundry without the risk of falling. So we can see that those words return to function mean a lot of different things depending on the stage of life somebody is and depending on the activity level that somebody is in. So what do you do when insurance won't cover your concept of return to function? Well, here's other question that many people have asked me is, what do you do when your insurance only covers maybe 20 visits, but you've had an ACL tear? And an ACL tear requires reconstructive surgery, rehabilitation, and 20 visits really is not enough visits to get somebody completely back to either their sport or to just daily living, where they can walk on a beach without worrying about their knee being unstable. Another question that people have asked is, what do you do when your insurance helps you recover from a hip fracture, but it won't help you cover the maintenance of fall risk or fall prevention or maintaining your strength so you're less likely to fall again and re-break or re-injure your hip? And what do you do when your deductible is so high that unless you have a catastrophic injury, you're never going to meet that $10,000 deductible from a basic injury like an ankle sprain or a trip on the stairs or a shoulder injury from overuse because you lift your arm frequently? So what do you do in these cases where you're relatively healthy, but your insurance doesn't cover your return to function? And what do you do when you don't have health insurance because you are healthy? So you definitely have options, and I want to explain some of those options. Now, I can't speak for other physical therapy clinics. I can only speak for some of the options that I offer people, but they are out there. And if you're not in the southeastern Wisconsin region, I encourage you to call around and find the physical therapist that you can connect with who might have similar options. Now, if you have a surgery and you are only offered 20 visits, you have the option of being able to space out those visits so that you are working with a physical therapist maybe once a week and then working on your own to follow that plan of care that physical therapist recommended. Now, the pro side of this is you're saving your visits. So you're spending less out of your own pocket. and you've got your visits that you're spacing out. The con of that is that you can really be missing out on the cumulative effect of the physical therapy with a physical therapist. So if your physical therapist is recommending 3 times a week because you had an ACL reconstruction and you only work with that therapist 1 time a week, you're missing out on the cumulative effect of having the guidance of the physical therapist and the skill of the physical therapist to help you get your range of motion back, to help you through the healing phase of that surgery or post-surgery, and then also advance you to the next level. So you could be slowing down your rehabilitation if you choose to kind of limit your visits and space them out. Now, the second option that many people have is you can follow that recommended 3 times a week. We'll stay with that example, that recommended 3 times a week of physical therapy and the initial phase of physical therapy. I break my sessions down into 3 phases. The first phase is healing, getting range of motion back and reducing pain. The second phase is starting to strength train. It's teaching people how to walk correctly if they've been on crutches. And it's starting to get them back into some of their regular activities. Phase 3 is getting them back to their regular activities, their daily activities. The phase 4 would be getting them back to their sport, getting them back to their normal fitness routine. So one of the options that you have is to really kind of follow that PT recommended program in the initial phase of reducing your pain, restoring your motion, and going through that healing phase together, and then starting to space your visits out when you're doing more strengthening and maybe require a little less hands-on therapy from the physical therapist. The pros of this is you get the advantage of working with the physical therapist and their skills and that initial phases that can get you kind of into that second phase. The other advantage is you know that you're going to be kind of saving and spacing your visits out later, so you can really kind of take advantage of that cumulative effect early on in the rehab process. The negative side, or the con of that, is a lot of people in that second phase, they're not having as much pain and they have good range of motion, but they're not strong yet. So there is a tendency, if you're not working under the guidance of a skilled physical therapist, to kind of push yourself a little bit faster than maybe your healing tissue can accept. So there is a good risk of re-injury and the likelihood of a setback if you're not seeing that physical therapist on that recommended plan. Now, the third option you have is to actually follow the recommended plan of a physical therapist. And if you're limited in your number of visits, then you have the self-pay option when you've run out of visits based on what your insurance company covers. So the advantage of this is that you are following the recommendations, you're working one-on-one with the physical therapist through your entire rehab program, so you're going to get that individual attention, you're going to get the hands-on therapy, and you're going to get the skill and the knowledge of the physical therapist to know when to kind of push a little bit more and when to back off, because you'll be seeing them on a regular basis and following their specific recommendations. The negative side of that is the financial cost that it can cost to you. So what do you do if you want to follow the physical therapist and you want to kind of have that guidance and have that advantage of getting back to whatever you want to get back to and whatever you love on a timed scale based on the recommendations of your physical therapist? What do you do with the financial aspect of that? Well, if you don't have insurance or you've run out of your insurance visits, then again, you have options. I can only speak for my clinic here, but I offer treatment packages. So when a person reaches a self-pay status, if they pay in advance for their treatment sessions, then they get a discount. And the other alternative I give people is to be able to kind of have a payment plan. And so we set an amount, we go through the recommended package, but then we break that down to a monthly subscription, so to speak. So they're only paying an amount that they're comfortable with over a month, 2 months, 3 months, or even 4 months. So we set up a payment plan. And a third option is if you have a student athlete who requires more physical therapy than their insurance will cover, then if they have a certified athletic trainer at their school full-time, I've done this before where the patient will actually see me once a week and we can space out the insurance visits, and then that student athlete can work with the athletic trainer 2 to 3 times a week at the school, and I'm communicating with that student athlete's certified athletic trainer so that the athlete is following a specific plan and following the recommendations and also getting the benefit of a healthcare provider at the school. So this only works if the student athlete has a certified athletic trainer available to them. It also only works if the certified athletic trainer approves that and the school approves that. So there's a lot of little what ifs involved in that process, but it's certainly something to inquire, and it's something that I've done in the past that is very effective and kind of saving those visits and working within the confines of the insurance company. Now, another option that people often have is on-site employee benefits, and some bigger companies actually have a certified athletic trainer on staff that offers benefits to their employees. So on the rare occasion, they also have a physical therapist, but this would be something that would be unique to an employer, and the employee would have to see if they can take advantage of that. So the employer would have to approve it, and the certified athletic trainer on site would also have to approve it, but I would be more than willing to work with that person so that they could work also within the confines of their insurance company. Now, there are some other options, so that's already 4 options that people have, and there's additional options available. Some people may even want to transition into a post-rehab program where they're working with a physical therapist maybe once every week or once every 2 weeks, and then what they're doing is they're working independently. So my job as a physical therapist as part of a post-rehab program would be to make sure that my patient has the right equipment at home. And this could be something that they already have been using from their physical therapy sessions, but now we want to make sure that it's exactly like they have an exercise ball, they have some resistance bands, they have some dumbbells, maybe they have ankle weights. So they kind of have their own little mini gym at home, and then I would set them up with a treatment plan. And then what would happen is they would work on my specific exercises on certain days of the week at home, and then we would touch base either by email if there were questions in between our live in-office sessions. So there's this post-rehab program that is available, and then there's also a medically based fitness program, and this might be in-house or this might be online. And I now have the ability to do live chats or web chats, sessions where I can talk with my patients on a live chat, and I can see how they're moving, and I can give them exercises to do and touch base with them that way. This is a new program that I'm starting to offer, but it's a really cool thing because somebody can be working independently, but then be setting up appointments, 15 minutes, maybe even 30 minutes with me, and then we just communicate via the web. And so they have a web-based appointment, and I can see them and they can see me, and then they get exercises that way. So there's lots of different options available to patients when insurance companies don't want to pay beyond their definition of return to function, but that return to function isn't the definition of the patient. I hope this has been helpful. I see a few people have joined. Hi, Brennan. Hi, Tiffany. Hi, Joelle. And I'm so happy that you came in. If you have any questions, please go ahead and write those comments in, and I'd be happy to answer them. The big take-home point is that just because your insurance says no more doesn't mean that you have to accept that. You have lots of options that are available to you. You have a patient right to inquire about those options, and they're available to you so that you can confidently say yes to your health. Yes, I want to continue and I want to improve my health, meet my goals regardless of what an insurance company is dictating. Again, I hope this has been helpful. I welcome any questions. I don't see any questions right now in the chat, but if you have any questions, you can contact me at 262-842-2220. You can also email me directly at Jeanette@dewittptwellness.com. And feel free to visit my website, www.dewittptwellness.com. I have lots of YouTube videos as well, so you can look up DeWitt Physical Therapy and Wellness on YouTube, and you will come across some videos on how to do certain exercises as well. I thank you very much for joining me, and I look forward to next week when we're going to be talking about Concussion 101. Thank you very much. Have a wonderful and blessed day.